Next investigation in the list is thyroid function test. So the first and foremost thyroid function test is TSH, thyroid stimulating hormone. Its normal value is 0.3 to 3.3 milliunits per liter. And this is established as the first line thyroid function test to assess thyroid status. TSH alone can only be used to assess thyroid status, but when the hypothalamus, pituitary, thyroid axis is stable, conditions like non-thyroid illness, pituitary disease, and some other various medications can affect this axis and causes discrepancies between thyroid stimulating hormonal levels, thyroid hormone levels, and the clinical state of the patient. Drugs like glucocorticoids, dopamine, octreotide, they act on the axis and suppress the thyroid stimulating hormone. Normally when TSH level is indicated, apart from thyroid dysfunction, it is also indicated in reduced bone mineral density, dyslipidemia, depression, and atrial fibrillation. Moving on to thyroid hormones, we have free T4 and free T3. The normal value of free T4 is 10 to 30 nanomoles per liter. This is indicated as a second line test when the TSH measurements are known to be unreliable. When there is TSH abnormalities, we rely on free T4. It is the principal hormone secreted by the thyroid gland, but it is a prohormone with minimal biological activity and gets deiodinized in the peripheral tissues from T4 to active hormone T3. This free T4 is the superior indicator of thyroid status. Next to TSH. The next one is free T3 and the normal level is 3.5 to 7.5 micromoles per liter. And the only real indication for free T3 is if T4 is not above the reference range. Normally, increase in free T3 indicates diagnosis of T3 toxicosis, which is not a disease entity but a description of a biochemical profile typically observed in toxic nodular hypothyroidism and Graves' disease. So there are conditions with increased TSH with normal T4 and decreased TSH with normal T4. Here, where the TSH is more with normal free T4, the conditions are recent treatment of hypothyroidism, subclinical hyperthyroidism. The meaning of subclinical is the thyroid hormones T4 and T3 remains normal, whereas the TSH level varies a little. Non-thyroid illness during recovery phase, some medications, interfering antibodies against thyroid hormones, resistance to thyroid hormones. And what are the conditions where the TSH level is low with normal T4? Subclinical hypothyroidism, recent treatment of hyperthyroidism, when there is T3 toxicosis, drugs like steroids, dopamine, non-thyroidal illness, pituitary disease. These are the conditions where there is less TSH and normal T4. Here we have conditions where there are normal TSH with increased and decreased free T4. So the TSH level is normal whereas the free T4 is increased. This is central hyperthyroidism. When the patient receives T4 therapy, there is a condition called familial dysalbuminemic hyperthyroidism, and few conditions where free T4 is decreased without any change in TSH is non-thyroidal illness, treatment for hyperthyroidism, and pituitary disease. Assessment of TSH level is mainly to diagnose thyroid disorders, commonly hyper and hypothyroidism. So when the TSH level is low, it is the indication for hyperthyroidism, and when it is high, it is for hypothyroidism. TSH levels in pregnancy naturally increases the thyroid hormones in blood. And why during pregnancy the thyroid hormones are normally high is for the development of fetal brain nervous system. So when there is increased thyroid hormones, automatically there is decreased TSH level in blood, and doctors generally use low reference range of TSH for pregnant women. But when we notice the TSH level gradually increases in second and third trimester, but they still remain lower than the normal levels in women who are not pregnant. So it is very important to carefully monitor TSH throughout pregnancy. Having unusual high or low levels can affect the risk of miscarriage, preeclampsia, premature birth, low birth weight, and congestive heart failure. So what do high level means? High TSH level indicates hypothyroidism, and the clinical signs and symptoms of fatigue, weight gain, edematous face, neck, intolerance to cold temperature, dry skin, decrease in heart rate, irregular menstrual periods, fertility issues, depression, and constipation. And the general treatment of choice is levothyroxine. And what does the low TSH level mean? It means hyperthyroidism, and the symptoms are heat intolerance, excessive sweating, increased heart rate, muscle fatigue, anxiety, tremors, palpitation, diarrhea, mood changes. And the management includes symptomatic treatment, anti-thyroid drugs, radioactive iodine, and finally thyroidectomy. And symptoms like tachycardia, anxiety, tremors, palpitation are treated with beta blockers, and the most popular drugs are propranolol, stenolol, metoprolol. They are only symptomatically effective, and they do not alter the level of thyroid hormones in the blood. Next line of conservative management is anti-thyroid drugs. The two main drugs are methimazole and propylthiouracil. And the major adverse effect of these drugs or reduction in the WBC protection, which is agranulocytosis. Thank you.